Now, we got a lot of questions prior to this webinar. You also, thank you very much, everyone, for sending in the questions. What we do is we'd like to answer some of those questions. And then also, once we finish that, we'll jump into the questions that were asked during the webinar itself. Now, we do have a lot of questions, so we're going to kind of run right through these. But please feel free to ask questions. And we want to make sure that, I know that there are times where you're just kind of in a quandary as to what to do. And we're really here to help quite a bit. Manny, first question is, what marijuana products are best for generalized anxiety disorder? I currently take Xanax because my anxiety is so bad. And I think it really ties in also to what strains help the most with impulsive behaviors caused by anxiety. You covered a lot of that in the previous slide.
Yes, and to that point, we actually most patients have different routes of administration. 5 different routes. You have oral, sublingual, topical, edible, inhalation, and then the last or the sixth being the smokable route. So you have different marijuana products. It's more of what you're going to be wanting to take in. Do you want to inhale? Do you want to vape? Do you want to smoke? Do you want to ingest? And then we also want to figure out what kind of onset are you looking for. If you inhale it, it's a rapid onset, almost immediate. If you ingest it, it'll take a little bit longer. We have transdermal patches that could last very long time, 10 to 12 hours, with a small microdose throughout the day. So it all depends on what methods you're looking to use and what you have going on in your life. So that way we can better direct that question or the answers to that question.
Right, and really, it's really not complex. What you really have is a lot of options that you can personalize it to make it easy for the patient to be able to take the product.
Exactly.
Let's jump into the next one. What terpenes work best for anxiety and stress? And can any of the terpenes help with the physical effects of anxiety, like nausea, nerve pain, and restlessness? You just covered a lot of the terpenes.
Yeah, the four on the last slide was limonene, pinene, caryophyllene, and linalool. Those are great ones. One that wasn't mentioned on there is myrcene. A
Right.
lot of people who deal with anxiety or stress usually automatically go directly towards indicas as far as the category, and that's because those are usually heavy in myrcene, linalool, and those type of terpenes. However, the trade-off is you're only using it in the evening or after work because it makes you very tired or too relaxed sometimes, and you need something during the day. And that's when limonene by itself comes in, pinene by itself, or with other terpenes, just not together. Caryophyllene and linalool would be the top four I would suggest.
Right. Next question is a very good question. I know this has to do, she talks about caregivers. Can you provide insights on the best cannabis options for caregivers managing stress? Need to always be mindful and present and accurate. I can relate to that because I have herniated discs in my neck, 7 of them, and two herniated discs in my back, and that's pain. There's no question. But I have to be mindful. I have to do these webinars and the other parts of the businesses that I run. I have to be very present. So that was really an important part, at least for what I was taking a look at. And I think the key to this one is really, I'm going to have you talk about the cannabis options, but I think before we get to that, you really need to find what your therapeutic dosing level is. Where is your sweet spot for cannabis? Because once you understand that, then you can really fine tune the terpenes and the routes of administration that are really best for you. I know, Manny, your thoughts on this, because I think that, again, as a caregiver, you don't want to be high, but you want to be able to get the relief you need. But again, I think also a dosing, not just a cannabis product question.
Absolutely. I 100% agree. And to that point, always go low and slow. We have products with a high CBD, 19-to-1 ratio, 12.5-to-1 ratio, and a 5-to-1 ratio, up to 1-to-1. And the key on that is anytime you have a higher number of CBD to THC, the less euphoric the effects will be. When you become more balanced, like a 1-to-1 or higher THC count, then it becomes more euphoric or psychoactive in that sense. The reason I use euphoric to clarify is because there's a lot of things that are psychoactive as altering your mindset. And for instance, the 5-to-1 serene is very, very good for daytime use, clarity, focus, stress. Longer you use it, even inflammation, which will help with pain. However, that amount of focus and clarity it provides could be misunderstood as a euphoric effect or a high. And as your body gets acclimated to it, then obviously you won't feel like that anymore. So some of the products I would recommend: Tranquil, 19-to-1 ratios at high CBD. The 12.5-to-1 calm could be very good, but it could be kind of subtle and relaxing. And then my favorite personally is the 5-to-1 serene. Now, keep in mind, a lot of these you won't be able to find in a vaporizer simply because of the high CBD content. It'll naturally crystallize and it'll do that in your vape and cause your vape to clog. So you could get these in gummies, chews, sublinguals, and you can even get them in patches as well.
Right, right. And that answers one of the related questions, which is the best daytime use, because by being able to use, for example, a gummy should last between 8 to 10 hours, and you can take it before your shift and it'll work during the day without having to take cannabis in the middle of the day.
Correct.
That's the other question is, how do you treat your condition while at work or outside the home where Dr. MMJ is not available? And I think, again, I'll go back to look at the onset time, and look not only the onset, but the duration time. How long does it actually work? And this is where things like gummies and sublinguals come into play.
Absolutely. And you could, and the related part to that is like 1 a day pill or as needed. Typically is going to be as needed. However, you might find a regimen that works so well for you where you're only taking one Theragel or one gummy or one chew or whatever it may be. And then later in that evening, you switch to something else for nighttime if needed.
Sure.
So it's always going to be as needed because each person is going to be different. And always try to keep a little journal, keep a little notebook. I have like 4 or 5 little books that I've filled up now with notes, particularly from my feedback that I get from patients, because that's how I learn and I can help educate other people.
Yeah, I think taking notes and keeping a journal really makes a lot of sense, because it really helps. At least it helps me remind. I always think I can always remember everything, and then I go back and say, what was that? So it doesn't hurt to be able to just jot that down and note that. And I do want to point out, when they say, is one pill a day going to work or not, it really depends on your particular condition. I know that there are folks with anxiety and stress that once they get that kind of out of their body, once they get out of it, for the rest of the day, they're good. But in my case, for example, of like myself with herniated discs, they're not going to go away. So if I don't do something in the evening, the pain is going to come back and I have to address it. So a lot of it also has to do with your condition to address
Little
that.
caveat to that too, Mark, is whenever you're ingesting cannabis, you want to make sure you have something in your stomach. It's not so much like most pharmaceuticals where it could damage your stomach lining or anything like that, but cannabis is a fatty molecule. So it needs something fatty to attach you to get into that bloodstream, get past the guts. However, you don't want a full stomach and you don't want to go to bed on a full stomach. So I usually tell people a little cup of yogurt, a spoon of peanut butter, or whatever your poison, so to speak, is. Take that, then have your edible, your sublingual, whatever. It'll be more effective. You'll know if you're not doing it right because the next morning you'll wake up, you'll have breakfast or whatever it may be, and all of a sudden you get another second wave of something. That's the second wave coming from it attaching to whatever you ingested, getting back into your bloodstream. So just be sure to dose slow, take your time, and journal it so you know how to go for the next day or the next night.
And also, if you're trying to work during the day, don't forget patches.
Mm-hmm.
Because patches will work. Again, they could work, as you mentioned, 8 to 12 hours, and that takes you through the workday, and they're microdosing, which is really, really great. So
Absolutely.
it helps quite a bit. So what's the ideal products to reduce anxiety at bedtime when you want to shut off the mind and fall asleep? You have one of your products that I think is pretty interesting, is Dream, right?
Yeah, absolutely. It's actually the same ratio as our Relief, 1 to 9. So it's a high THC product. The difference is the terpene profile. Dream is going to be more ideal for a racing mind. Just can't shut things off. Whereas Relief is going to be more for pain relief and then shutting down the mind and helping you sleep. We also have another product, 1-to-1 Soothe, that's really good for that. Because if you can shut things down without forcing yourself to sleep, like Soothe has been known to do, then you get a more natural sleep. And that itself may lead to a better day the next day where you're not suffering from certain stressors leading to the anxiety you suffer from overall.
Yeah. Yeah. But I think, again, you pointed out something that's really, really important, which really leads into the next question. And that is, it's the terpene profile that makes a big difference. Because here, the next question is, I have debilitating anxiety. I have a hard time finding strains, indica and sativa, that don't cause more anxiety. Help. And a related question, I get terrible anxiety, paranoia with THC use, even with CBD advice. First of all, I want to step back from using the word indica and sativa, because that's something where indica was used for years to indicate products that was more relaxing, sativa more energizing. But really, in the last 5 years, there's been so many genetically. People like Surterra and a number of dispensaries have been genetically modifying the products to really target in with terpenes a particular condition. Like Dream uses the terpene profile to address sleep. And so it really, what you're looking for is the right cultivar, the right combination of terpenes and also strains. And I think sometimes when you just look at indica and sativa, you're not necessarily focused on the real keys that are going to help you, which are the terpenes. And I think one of the answers to this question is get a consultation, because this is where you can not only have people at Surterra explain to you the products that can help you, but I think the second thing it'll do is be able to give you somebody that you can talk to. So as you're getting your dose, to get your dosing right, and especially to help you get the formulas, meaning the routes of administration that can help you fall asleep.
Yeah, 100%. Typically, when we hear somebody say indica sativa or a hybrid, that just gets us in the general area. That's kind of like saying I want a white wine, red wine, or rosé. You still have so many selections within those categories. And it's not just going to be THC or CBD as isolates. One of the metaphors I like to use with that is, instead of imagine a muffin or a cupcake, even better, and what it takes to make that cupcake, so many spoons of sugar. Would you rather have the spoon of sugar straight to your mouth, or the spoon of sugar that it takes to make the cupcake and then eat the cupcake? Me personally, I'd rather have the cupcake and all the flavors, pumpkin spice and everything. So you want to make sure that you're checking out the terpenes, because you can have a very high CBD product with very little THC, but that terpene profile can actually induce anxiety or stressors rather than calm it and make it easier. So to your point, Mark, definitely you want to come in, have a consultation. We could get more to the point. As far as certain strains too, that I would mention right off the bat, just to try out, would be our Stupor Glue, which is a 1-to-1, and our Flaming Cherries, which is also a 1-to-1 ratio. Those would be really nice starting points if you're already used to high THC use. And keep in mind, since you're going to be implementing CBD, it may take a few days to a week or so before you start really feeling the effects, because CBD takes a little bit more time to build up in your system.
Sure. But I think it's really important to really match the terpene profile to your particular condition and make sure you have a route of administration that gives you the duration that you need to be able to address your particular condition. I think that really, when I hear questions like this, a lot of this has to do with the fact that of being terpenes matching the condition. That's where people like your consultations and Surterra come into play. So I hope that helps. What would treatment of anxiety and stress differ from treatment for chronic pain and fibromyalgia? Oh, by the way, on that previous question, one of the issues that could come up is if you, especially if you have PTS, pinene could be one of the culprits that really get in the way of or cause more anxiety when you are using the product. So pay attention to whether you have pinene in the product and how much of it that might help as well. Your thoughts on that, Manny?
Absolutely. Anytime somebody comes back, especially if it's in a certain category or certain profile that should have helped, when we go back and look at that certificate of analysis or COA, typically we will find a pinene, beta or alpha, somewhere high up on the chart in the top 5, and that's usually the culprit, like you said.
Right. Now, when they talk about the difference, by the way, between anxiety and stress treatment and chronic pain and fibromyalgia, anxiety and stress usually can be addressed by, again, CBD, getting you to calm down and getting you to relax. It really doesn't have a lot of pain related to you, where chronic pain, obviously, and fibromyalgia do. So I think that when you're looking at anxiety and stress, you're leaning more towards CBD, what I call dominant products, where when you're looking at chronic pain and fibromyalgia, you're going to be adding more THC and maybe THC dominant products. Your thoughts on that, Manny?
Yeah, so it's two different treatments as far as how I would consult about it. If you're dealing with chronic pain or fibromyalgia, typically you're going to start off with that high THC and implement CBD here and there as you can. And then as you balance out, you'll notice that the treatment for THC is going to lower, and you're going to start upscaling on the CBD and seesawing back and forth. When anxiety and stress, is just the opposite. I would start off with high CBD and work my way up to a medium to high THC product, depending on tolerance, and then seesawing back and forth from that point. So chronic pain, fibromyalgia usually start off with high THC. Anxiety and stress usually start off with high CBD.
Right, right. And I think that's important to point out. Again, one's targeting a component called pain that isn't in the other one. Other question is, I've heard that for anxiety, you should take something high in CBD or a 1-to-1 ratio CBD to THC. Is that right? I think that pretty much is correct. That's right on.
Yeah, you could start off there, or you can even microdose with low THC. 2.5 milligrams is usually the lowest you can find on the market. It usually gives up an uplift, and usually microdosing with low THC with not much terpene profiles like our mints usually are great for depression, stress, and when you're dealing with PTSD from trauma.
Right. Next question is a good one. What would appreciate some resources for quality products with high percentage CBD? And I wish Surterra would keep them in stock. I'm gonna agree with you that obviously being out of stock is frustrating. On the other side of the coin, remember a lot of these products, first of all, in high demand, and then secondarily, they're botanical based products, so they have to be grown. And again, if you kind of run low on stock, it takes you a little couple of weeks or so to be able to get them back into stock. Is that correct, Manny?
It is, and then of course with the laws in place, we can't import export.
Right.
Becomes very difficult that way. So we're limited to what we have in our grows, and then with the weather and so forth. However, as far as resources, if you want to look into more of the products we have, we just launched our assets, our digital assets online. So you can see what products are going to be available, and you can also see the products that are available for ordering right then and there as well.
That's great. That's great. Thank you. Okay. So let's see what else we have here. Why is it so hard to find smokable weed with high CBD? I'm gonna let you check this one because this is a good question. I never can find it, and it's the only thing that helps.
That's a great question. It's more supply and demand. A lot of the CBD flower that's cultivated, I believe, is put into other products such as edibles, sublinguals, topicals, so forth and so on, and not grown to be purchased, because the yield that would be grown in order for what is purchased, I think, will be counterintuitive. That being said, there are high CBD products that you can use in a vaporizer. Um, to that extent, that's about all I've been able to find in the Florida market right now. Of course, I find things in vape shops and so forth, which I don't back up or support. You just don't know what you're getting. There's no certificate of analysis or anything on that. So if you decide to go that route, be very cautious. But that's definitely a question now I'm gonna jot down here and maybe take up.
Well, I think that the point is that licensed dispensaries in the state of Florida really don't have a license to sell CBD only products. You have to have CBD combined with THC, especially as a full spectrum product. So it's very hard to carry those products. And so I think that as we get hopefully changes in the regulations here in Florida that open it up for dispensaries to carry more CBD products, I think it would help quite a bit. The other issue that you're dealing with is CBD is in such high demand to go into other products like tinctures and that type of thing, that also increases the demand and reduces the amount of flower that's on the market.
I've also been told, Mark, that even like on the hemp side of things, which is simply the federal definition of 0.3% or lower, to maintain that percentage under 0.3% is so difficult that if it goes over, instead of harvesting from the flower, they actually harvest the CBD from the stem and the seeds, which
Right.
is more industrial use, not so much medicinal.
Yeah, that's a good point. Next is a good question. I suffer from anxiety, PTS, ADHD, and are there products that can help me calm my anxiety without sending me into ADHD productivity analysis? And I think this goes back to really having a higher leaning towards the CBD dominant products. Your thoughts, Manny?
Yes, and this one I would actually almost have to have a consultation. I would need to know what those triggers are in order to find that terpene profile for this
Excellent point.
particular
Yeah.
person. Because to have all that and the concern of going into a ADHD productivity paralysis is not something we want to toy around with. Not nor do we want to toy around with anything else.
Sure.
But we would want to be more particular with this one. And I would actually go into the MMU profile for this patient and see if the physician put any notes, particularly for this one, so we can actually dial in with the physician as well.
This is an important question, and it needs to have a very let's just say an important, careful answer. The answer is yes, you can, but let's put you under the care of some folks that really can help you dial in the products, and I think that's where the consultations come into play. It's a good counsel, Manny. Next question. I can't handle sativa. How do I get a lift with only indica? That's a good question, Manny.
It is. Well, in the certain in speaking in the categories of sativa and indica, you cannot get a lift or a high with indica. You get relaxed and stoned, whereas sativa, you get the lift and high. However, you can use hybrids with the sativa lean. It all boils back down to the terpene profile. I would look for something probably with linalool or B-caryophyllene as first, with limonene as second. You
Right.
definitely want to have limonene somewhere in the top three. So that way you can have the effects of an indica with a slight uplift that's not too jarring or stresses you out more to induce an anxiety attack.
Right. Good point. Again, and also terpenes come into play. That's an important part of this. And as you were mentioning,
Mhm.
as you were pointing out. It says, I live a hectic and stressful daily life. Do I need to take time for myself to relax before medicating to avoid unwanted reactions? I think that anytime you're taking any medication, whether it's medical cannabis or not, it doesn't hurt to relax. Okay. But I don't think that's a requirement. Your thoughts, Manny?
It's not. I do tend to lean on that part of it if you're ingesting cannabis. When you're ingesting cannabis, diet, environment, a few things play a role in it because of how long it takes to react with your body. So you could be in a stressful moment at one point, and then it takes 45 minutes, an hour for it to actually react. And
Mhm.
you're no longer in that stress moment. And now that it kicked in, now you're panicked because it kicked in. So there's a lot of different things that go into the routes of administration. Taking
Yes.
the time to self-relax is always a good idea. And if you could do that before medicating, I don't see any harm with that. But I don't think it would cause unwanted reactions unless you were ingesting it and you found yourself in a particular environment where you didn't want to have that effect.
Yeah, and I know, at least I myself have, I wouldn't say, I live a life that's very busy. It can be stressful at times. But I think what I've also found is when I take time to just slow down for a minute to be able to relax, especially when I'm looking at using my medical cannabis, it's made a huge difference. And I think that mental discipline has been very important to me. And it's been just as important as the medication that I'm using. I think that's something that's very important to point out.
Hmm.
Love yourself, give yourself the time, because the only thing that's really going to be important to you is you. Let's put it that
Hmm.
way. The other question is, are you aware of any concerns in regard to anxiety medication combined with medical marijuana? I think we covered that in the presentation. You want to comment on that, Manny?
You did cover it in the presentation. There's very little medications. As Amy stated, usually it's blood thinners, platelet medications. However, always, again, go under the care of your physician if you're looking to wean off. And usually dealing with high CBD or one-to-one cannabis products with anxiety medications, there's not much concern.
Sure, sure. Um, Now, next question is a great one. What can I take when I am having a severe panic attack? Fast relief. I think this is where a number of CBD products come into play. Your high ratioed CBD products come into play. Your thoughts, Manny?
Yeah, absolutely. First off, it will be if you're able to and willing to and have already, inhalation would be the route of administration. You will have the effect within minutes.
Yeah, it works
And
almost
usually,
immediately, right?
yeah, and then one-to-one soothe or higher, depending on your tolerance, would be great because one-to-ones or higher will come in a vape. But then you're also going to want to make sure you have whatever other product that you normally use, if it's an edible or oral or sublingual, because about 20 to 30 minutes after you've taken that vape, within that hour, you're going to want to take something oral, sublingual, or edible. So that way, when that inhalation wears off, whatever you ingest it will start kicking in and you don't have that gap or that void where you're feeling like you're on a roller coaster drop trying to climb back up.
That's a good point. That's an excellent point. Good, good, good. Okay, let's see. My pain doctor won't prescribe pain meds because I use medical marijuana for my anxiety. What can I do? My answer is get a new pain doctor. Pain doctors today, I know that when I have a pain doctor because of my herniated discs. When I got them 7 years ago, I didn't find a lot of pain doctors that prescribe medical cannabis. At least where I live right now, most of the doctors are not only prescribing patients to go look at medical cannabis, but we're actually encouraging their patients to do that. So I think you can find doctors that have kind of become more enlightened. The old guard that isn't going to change really isn't going to make a change, isn't going to prescribe. I think you just need to find yourself a better, or excuse me, a new pain doctor. Your thoughts, Manny?
Uh, And from a Surterra standpoint, I can't really comment on the physicians because we don't know. However, from my personal standpoint, I've dealt with the VA, and to all the veterans out there, having a discussion with the physician is the first step. And then after that, of course, you're going to have to take into account your insurances and so forth, referrals. But if you're really looking to get better, how far are you willing to walk to get there? And sometimes we have to do that on our own to make sure that we can take care of ourselves.
Yeah, it's just a shame that a lot of the doctors don't have that open mind and follow that Hippocratic oath. But on the other side of the coin, I understand why. It's a lot more education and time on their part. But again, finding a pain doctor that's medical cannabis friendly is really, really important. And again, there's a lot more of them out there than there was even 7 years ago. And I know in my community, most of the doctors that are pain doctors are medical marijuana friendly. Next question is, I have a pinched nerve in my neck and the VA wants to do surgery, but I don't. Will the medication from marijuana help chronic pain? I have 7 herniated discs in my neck. Can they operate? Yes. And the 4 doctors that I talked to all had the same answer. They don't recommend surgery. And the reason for that is because with that many the chances of my coming out of that without a permanent disability is less than 10%. So that's not a route that we want to head down. I use medical cannabis to address the pain in my neck, and I have herniated discs, both to relieve the inflammation and also for the pain. And I think that this is again where I've had to experiment with, experiment meaning try different products, different ratios. What's my CBD to THC ratio to be able to get the formula correct? But I think the answer is yes. I think you can help with chronic pain. And you can help with chronic pain. I mean, I'm at a point where when I wake up in the morning, sometimes I have a level of pain of a 7 or an 8. And literally within 4 or 5 minutes, my level of pain is down to a 1. Now that's a combination of using a vape pen and also sublingual drops. The vape pen helps me get that pain level down to below a 1. And the sublingual drops, once that vape pen wears off, continue to help me to keep the pain down. And again, as you reduce the amount of inflammation, it'll help relieve the pressure on that pinched nerve. But the answer is, I think, yes, you can. And surgery, especially neck surgery, is risky. It's very risky. And if you can't avoid it, I'm not saying you shouldn't have it, but I'm saying if you can't avoid it, please do, because usually the pain to gain ratio isn't there. Your thoughts on that, Manny?
I couldn't have said it better to that point. I guess the only thing I could do to add on to that is some of the products we have that would be beneficial besides vapes and sublinguals would be, we have a one-to-one balm, we have lotions, patches, and keep in mind, just like you do with the vape and tincture, you can use a topical and use a sublingual or oral or vape and inhalant at the same time or in conjunction too. So that way you have that continuation of relief and a better quality.
Sure. One of the questions that comes up, and so I think that's really, really important. Uh, it says, I see a therapist, a psychologist for anxiety and depression. I am unaware of their stance on this. Do I need their approval? Well, I don't think you need their approval, but I do think it wouldn't be a bad idea to let them know. I think anytime you're dealing with a medical professional, dealing with all the cards on the table are really important. I think a lot of people are afraid to let their doctors know because they're afraid, like the first question that came up on this chart, of having a doctor that's not medical cannabis friendly. I would say let them know, err to the side of caution. And if they are not medical cannabis friendly, find yourself one that is. I think that's kind of the way I'd approach it. Manny, your thoughts?
Yeah, I do the same thing, and keep in mind that you're not necessarily getting your medical marijuana recommendation from your primary care, and you don't need a referral. So it all depends on the circumstances. But as Mark said, as you suggested, letting all your physicians know what's going on, especially if you're getting prescribed medications or recommendations for medical marijuana, it'd be a good idea to have everybody in the loop.
Right. Now, next question is really a good one. It says, any suggestions on how to manage being hospitalized without access to medical marijuana for pain relief? I don't want to use other medications for severe pain. I had my left knee replaced, and obviously in the hospital, they will not let you use anything that they don't prescribe, aka no medical marijuana. I was operated on Monday, and I got out of the hospital on Wednesday. And so there was a 2-day period. I did not have a choice, but I did have to use Percocet, at least on Monday, and part of Tuesday. And I think that there is no real answer. There's no way of accessing it inside a hospital legally without causing a potential problem. I think you're kind of forced up against the wall. Now, what I did on Wednesday was I knew I was going to get out of the hospital about midday. I ended up taking no pain medication. And was I in pain when I was checked out? The answer is absolutely. Now, I went into the parking garage. My wife was driving. We had already planned this. I basically took a couple hits off the vape pen and then took some sublingual drops. And basically, by the time we left the garage and got onto the street, my pain level had gone down to less than a 1. So that's how I managed it. But again, if I'd have been hospitalized for 4 or 5 days, I would have had no choice but to have to go with the hospital recommendations. It's unfortunate that's the legal situation right now, but don't put yourself in a position where you can get arrested or go something against the doctors with the grain, because again, we want you healthy and well. And if you take a pain medication for a day or two, you can always go back to medical cannabis after a day or two. So what CBD, does CBD help regulate THC tolerance? Absolutely, right, Manny?
100%. And it kind of goes into the second question after that. When taking a tolerance break, what is the best way to treat heightened anxiety? CBD. So
Right.
when you take that tolerance break from THC, or even better, what I would suggest trying before taking a tolerance break, if you're not already using high CBD at times when you're not using high THC, such times when you're at work or doing something otherwise, try to do that first. Implement CBD in your regimen throughout times when you're not using high THC, and you'll probably find that your THC tolerance will drop automatically within that day after using CBD. If not, then that's when I would suggest only cut back to straight CBD or high CBD products, 5-to-1 or higher, like our Serene, our Tranquil, or our Calm. And you do it for 3 days, and then you go back. And the beauty of it is that CBD is also helping to prime your receptors to be reinitialized, so to speak. It's kind of like a makeover of a restaurant for a grand opening. So the reward is worth the effort, I promise you.
Yeah, and a lot of the tolerance break is really to take a break from THC.
Mm-hmm.
That's important to point out there. Cool, good advice, Manny. Why does medical marijuana make my heart race? You want to attack that one, or you want me to take it?
Sure, I'll start off. It's it's not so much the medical marijuana. It's going to be that terpene profile and that THC percentage combined that's doing that. And it also can have to do with your environment. You're not in a place that's probably conducive to what you were hoping to feel. So I would definitely check on what you use, journal it down, come in and have a conversation with us. We'll break it down and show you exactly why and get you a better product that will not do that.
Yeah, medical cannabis can increase your heart rate. It's not going to dramatically, when you use the word race, I think that's a dramatic increase. Some of that may be from the product, could be the terpene profile, which Manny was pointing out. And then candidly, sometimes when you get into an environment where you take medical marijuana and you worry about it, it basically causes that anxiety, that heart rate to increase that's out there. So pay attention to what the problem, what the solution is based on the problem. Is it medical cannabis based? Is it environment, or is it both? And you may want to address both of those. And again, a consultation, I think, will help quite a bit.
Yes, sir.
How can I find strains that are very high in pinene? I think your bud tenders and your certificates of analysis will help with that.
Absolutely. Right off the bat, if you're looking for a semi-euphoric effect, great daytime product, Revive is super high in alpha pinene. We also have Tangy in a vape. We have, if you're looking for flower, one of my favorites was Hot Mess that I'm looking to get back. We also have Melancholy and a few other strains. But yeah, come in, tell us that's what you're looking for. We'll pull up the COAs if we don't know off the bat. And or if you just want to see the COAs for reassurance, and that way you can know you're getting the product you're looking for.
Right. Great question here. Is it better to manage anxiety by smoking versus using edibles, or does it just depend on the individual? A related question is, can medical marijuana products have side effects? I had a horrible restless leg and arms from gummies and sublinguals. First of all, we have routes of administration like flower, like edibles, like sublinguals, like topicals. So really find out what really works for you. You really, in many cases, sublinguals work very well for anxiety. Smoking works right away, no question about it, but also, it tends to wear off after 2, maybe 3 hours, where the sublingual drops will last a little bit longer. Edibles obviously last a lot longer, they'll last 10 hours, but they usually take longer to take effect. So if you need something that's going to solve this anxiety problem right now, really an edible is not really the way to go. You may want to look at like smoking or tinctures. And when it comes to what they call smoking, I really recommend not smoking a joint. I recommend dry herb vaporizers, because what you're doing is you're taking that flower and you're basically steaming it. There's no burnt material in it. Smoking, when you smoke a joint, you have burnt material, and anytime you have burnt materials, that's really not good for your lungs. Not that cannabis is bad. Cannabis is not worse than smoking tobacco, but any burnt material in your lungs you have to be careful of. Where when you vape, especially with a dry herb vaporizer, it gets around that whole problem altogether. And I think what you're trying to point out here is going to, when you're trying different products and getting side effects, this is where working with a professional, like a consultation, can help you identify the terpenes that you're using, what it's doing, what side effects, and then of course, which routes of administration can help you. Your thoughts on that, Manny?
Yeah, I agree. And one of the benefits of vaping flower rather than combusting it is after the fact is decarboxylized. So you could use that flower for something else. Me personally, I put it in my coffee when I run my coffee through, so I have a little bit more of an effect. And it's not overpowering because you've already evaporated most of the terpenes and cannabinoids out of it. So it's going to have just little trace amounts of it in it. Um, as far as the side effects and having a horrible restless leg, RLS, and arms from gummies and sublinguals, it's possible. We would have to look at what you were using, the terpene profiles, the THC content, what else may have been going on at that time, and what your diagnosis or symptoms are to really dial in and if that was the cause of it, and if so, how to steer you away from products like it.
Sure. So the answer is yes. These situations can be managed. I think what we need to do is get somebody like a consultant from Surterra to help be able to really diagnose those. Next question. I have noticed that I do well with taking edibles and vaping when necessary. Would this be considered a normal way to treat anxiety? First of all, whatever normal way is whatever works for you. That's what's really, really important. I don't think there's any standard or normal thing when it comes to cannabis, because every person's body is different. And by the way, that goes the same for pharma drugs. The doctors just don't talk about it that much. They usually give you the lowest possible dosage and hope like hell it works. And if it doesn't work, you got to go back and ask them. Where in cannabis, at least you can manage that. But what I'm trying to point out is that I think this is very normal. It's something I know that I do. And I don't necessarily use edibles. I use a lot of tinctures in vaping. But I think that it's something that, yes, the answer is really works really well. And the other related question is, will tinctures, for example, work as well as gummies and smoking? And I think the answer is yes. Again, that goes back to making sure you have the right terpene profile. Your thoughts, Manny?
Yes, absolutely. Also keep in mind when you're taking those sublinguals, you want to kind of hold it under your tongue or in your mouth for a little bit, 30, 45 seconds. The terpene profiles in edibles specifically or ingestibles, um, or terpenes in general are very volatile, but specifically in ingestibles, because as soon as it hits that stomach acid, that terpene profile is no good anymore. And you basically have an isolate. So whenever
Right.
you're dealing with sublinguals, gummies, or something like that, as odd as it may sound, try to hold it in your mouth as long as possible. The gummies are a little bit better because they taste better than the sublinguals. Usually the sublinguals are a little earthy.
Right.
But you'll get a better effect from it. And I do agree, Mark, there is no specific way. What this is suggesting to me is that was what was consulted to the person and it happened to work. And if it wasn't consulted and you found it that way, my hat's off to you, because everybody's different. And that's the normal thing, is to find what works for you, not what works for everybody else.
Yeah. Next question is, my current Lexapro prescription is 10 milligrams a day and it helps a lot. Can medical cannabis or medical marijuana replace it? And if so, how? I think the answer is yes, medical cannabis can replace it. Again, this is a matter of going low and going slow. And I would recommend working with your medical doctor, and then also working with a medical cannabis practitioner, like a consultant from Surterra, to be able to make sure you get the right ratios. You're not going to get off it cold turkey. You're going to wean off it. But as you do that, you want to be able to do it in a way where, as you're doing it, you know what if medical cannabis is working it and how much is working and how much, and then what terpenes will actually work for you. Your thoughts on that, Manny?
Yeah, that's that on the backside. Yes, I can't really speak to the Lexapro part of it, but yes, I'm sure it can help.
Yeah.
But you just got to do it with some assistance.
Right. But again, work with your doctor, work with your medical cannabis professional, and you can get this done. So, can you obtain a card if you are a notary in Ohio? I don't know what the answer to that question is. I don't think, I know that here in Florida, you can be a notary and have a medical cannabis card. I believe, yeah, I haven't heard of any problems with that. I know my notary has a medical cannabis card. So, but I don't know about that in Ohio. I would have to look that one up. I'm going to flag that one as a question, and we'll try to get back to you on that. I would suspect the answer is yes, but again, every state is different. Let's just make sure that that in fact is the case. I don't want to come up with an off the cuff question. Can I get a medical marijuana card if I am 20? And the answer is yes. However, when you do that and you go to your doctor, you're going to need two doctors to give you a second opinion. The state of Florida here requires two doctors to be able to make that recommendation.
I believe that's under 18, Mark. If you're under 18, you need two physician referrals. If you're over 18, then you only need one physician referral, which is your medical marijuana physician, and you should be good to go. But they're likely going to limit you on certain routes of administration, or at the very least, the milligrams that are available because of the age.
Okay, sorry, I was dated with the whole old data on my part, but yeah, 18, which is great. Thank you very much for that correction. I have a very negative effect by the use of CBD, almost the exact opposite of what people normally have. What are the best alternatives? I have a very good friend of mine who actually is in the cannabis industry that has this exact condition. It's very rare. There's not a lot of people that have this, but it turns out it's almost an opposite effect. CBD acts like THC, and THC acts like CBD. What's the best alternative? Basically, you got to go back to go low and go slow. And in many cases where you go with high CBD products, you may want to take a look at reversing that and going with high THC products. I think that's what this gentleman does. It just took him a while to be able to, again, go low and go slow and do the dosing to figure out what's there. Your thoughts on that, Manny? By the way,
yeah, that's it.
It's not a common condition, but it is a condition that exists in the market. I just want to have you feel you're not alone.
I was just going to suggest, it's a very unique case. I've only met one other person with something similar, and they actually tried THCA, which is the acidic form, non-euphoric as well, despite the paradoxical effect here. And as long as you don't combust it or overheat it or use it to cook, you could try the THCA very low and slow and see what therapeutics you get from that, which are pretty significant in an acidic form. Most people don't know that because they usually use the THCA in order to add an extra boost of THC to other products that they're combusting or heating up.
Yeah, that's really good. And again, a consultation would help as well. I like an indica, but how do I choose a product to avoid the munchies and disturbing my stomach? I think this is a very individualized situation. I know that this is where you really want to take a look at, again, that terpene profile that helps drive the munchies. Your thoughts, Manny?
Yeah, so I've been picking at this one a little bit for the past couple of weeks because I've been getting certain feedback on it. And what I'm finding is that it seems like since you're more relaxed, the blood flow is going more to your organs, hence you're getting hungry and you get the munchies from the indica category. However, there's a specific terpene, I believe humulene, that works really well to curb that, as well as THCV. But THCV, you're really getting at high temperatures. Those are more in the dab area where you're getting a very significant euphoric or psychoactive effect.
Right.
But it does curb hunger, THCV, and then humulene would be the terpene I look for.
Good point. That's there. Here's a very good question. I'm 100% disabled veteran of PTS. Can I get this in the mail, or do I have to come to purchase it? Manny, you do delivery, don't you? You can get it delivered, actually.
Absolutely. So we do deliver. You do have to be present, or your caregiver with the caregiver card has to be present. Cash on delivery,
when it's delivered to your location, right? Yeah.
Yeah, we'll bring it right up to your door. We can't come into your home or anything. We have to remain in camera view of the vehicle, of course. But yeah, we'll bring it to you. Anything over $150 is free. Anything under $150 will have a $25 fee attached to it. However, it's very easy, depending on your discounts if you're a veteran or otherwise. to hit that 150 mark to get the medicine you need. And usually if you're spending that much, that medicine will last you about a month and a half, depending on what you're getting.
Sure, that's great. So yeah, use the delivery route that's really there. What terpenes are best for depression? What strains? I think we covered a lot of that, right, Manny?
Yeah. But real quick to reiterate, terpenes for depression, pinene, limonene, wouldn't necessarily put them together. Strain wise, I would go with the hybrid category or sativa, but hybrid with a sativa lean are safer typically for those suffering from anxiety or stressors, at least to start off with until we find your terpene profile. But I would look for pinene and limonene particularly.
Right. Can cannabis/CBD help those with Alzheimer's? There's been some studies done that have been released in the last 2 years that have shown that it is actually helpful for Alzheimer's. In fact, it does some things to address it. Now, be careful because it's not going to reverse Alzheimer's. What it's going to do is it's going to slow it down. And I think that's the important part, and actually help the cognitive functions of the person that's suffering from Alzheimer's. Now, you've seen some of that, haven't you, Manny?
Yeah, I've seen a little bit of it. I haven't had enough to where I could see a lot of it, but it's the neuroprotective agents that are found in cannabis as well that helps slow it down. I haven't seen any reversals, but I have seen, I guess it seemed like improvements because of how it helped them focus a little bit and it slowed down the process.
Right.
So that's always a great thing, but I haven't had much experience with Alzheimer's particularly yet.
Yeah, I have 2 patients. One of them is a very somebody who's important to me, and they have Alzheimer's, and I'm working with them on it. And we have them on a regime of cannabis, and it is very high in CBD, and it's something that has, again, it's not reversed it, but it has significantly slowed it down, and that's what's really important. Having this person stay present is something that we all want to have happen.
I agree.
Okay, a couple of last questions from the pre-submitted questions. Can Parkinson's disease be treated with THC alone, or do I need a prescription medication too? Parkinson's really is going to be helped a lot with CBD along with THC. I think that's really important. You do need to have some THC in there, no question about it. But the recent studies have also shown that CBD is actually can actually help quite a bit with THC. And there are prescription drugs that are out there. A lot of them have, if you look at the prescription drugs, again, I have a patient right now that has Parkinson's, and the side effects from these prescription drugs are just scary. So what we've done is we've kind of weaned her down. I've got her on a high CBD to THC. It seems to be working in her particular case, but again, every person's body is different. What's your experience been, Manny?
So I haven't had too much with Parkinson's as well, but for the ones that came in and talked back or gave us their feedback, said the same thing: high T or high CBD, maybe one-to-ones, but they never really went too high on the THC.
Right. I think, and that's what the studies have been showing lately. There's been more studies done lately that have come out. One of them was done in Spain, one of them was done in Germany, and it's really been really interesting to see the progress that's being made to look at helping Parkinson's patients, because that's really the important part. The key that we found, at least I found with my Parkinson's patient, is the negative side effects from CBD or from using cannabis are so much less than the prescription drugs that's what's driving a lot of these patients to use cannabis, because she's much more cognizant. She's feeling better. She actually the last night told me that she felt that her brain was actually feeling more energized. So she's a person that felt energized. It just didn't a lot of the prescription medication she took was just putting this dull effect on her body. So again, I would look at using cannabis, especially high CBD cannabis, for that. Next question: does medical marijuana help with menopausal and menopausal symptoms? I know that the answer is yes. And in fact, I think didn't Oprah Winfrey come up with a set of products just to address those?
Don't know for sure. I thought I heard something about that too, though.
Yeah, I think she did. The answer to your question is yes. And I know there's some products on the market from some other dispensaries that address this particular issues head on. But the answer is yes. Medical cannabis can help quite a bit with both of those. And again, I would recommend getting a consultation to make sure you get the right let's just say product and also terpene profile, because again, this is very much related to, very personalized as to what really can help you with that. That's there. Your thoughts,
Please keep in mind, regardless of the dispensary you're in for Surterra, how small it may seem or how big it may seem, we all have consultation rooms where we could go in for privacy. We all have different personnel that work there. So we could bring another female in for your comfort, or you could bring your husband or spouse in for your comfort. They don't have to have a card to accompany you into the dispensary. We just want to make sure there's no crosstalk and stuff like that for liability reasons. But we will sit down, we'll talk with you, we'll take our time, and there's no time limit on that. You could walk in. You may have to wait for a few minutes before we sit down with you, but we'll sit down with you for as long as it needs to be to make sure we get you the assistance you're looking for.
Right. Now, one of the questions is, do topicals or oral medications work better for arthritis? Is both the way to go? I have been experiencing a lot of arthritis in my hands lately. And so, and by the way, I'm going to throw a shameless plug in. Next week, we're doing a webinar on arthritis. So please join us then. We'll deep dive into that subject. But the answer is yes. I use a combination of a sublingual drop and also a topical. And I think the topicals help me quite a bit to get the instant relief, and the sublingual drops help relieve the inflammation. What you're really trying to do is relieve the inflammation. And so you need to have a product. In my case, I use a sublingual drop that really helps with inflammation. Your thoughts, Manny?
Absolutely. And again, I can't say it enough. The Fix one-to-one balm that we have is phenomenal for that. Using the drops or even an inhalant. Keep in mind, when you're using the topicals, unless it says transdermal, like their transdermal patches, it's not really getting into the bloodstream. It's not breaking your water table. So you're not going to get a double dose. Now, if it is transdermal like the patches, you're still only getting a micro dose of it. So you don't necessarily feel those effects. So you can still use an oral, sublingual, topical inhalation, or you could tag team it a few ways. Whatever your tolerance is, as long as you're feeling better.
Right. Now your balm is not your balm is not transdermal, but
No.
it does affect it does do a great job of addressing things like arthritis.
Yes, sir.
Okay, well, Manny, I'm going to go try it. We'll find out. All right, so let's talk about the live questions that came up. One is an easy one, Manny. What's the proper use of a syringe from Surterra?
So it depends on the product. We have our FSO full spectrum oil in a syringe, and we also have distillate syringes. Some are push plungers, some are twist and then push. So it depends on which one you have. As far as the product's concerned, you don't want to take too much. Anything around the size of a rice grain or is a little bit smaller. And I've had a bit of feedback. Some people like to do it on wax paper or parchment paper, put it in the freezer, and then just pluck it off and use them as lozenges. Some people use them to make edibles. So there's quite a few ways. I know some use theirs to refill vape cartridges, as well as our twist dispensers come with a blunt tip that you screw on the top that's efficient for that. So it all depends on what you're actually trying to do, but there's numerous ways to use a syringe, and that's the benefit of it.
Yeah, great. Next question. Surely that's a good question. Will you be able to get a copy of the slides for future reference? And what is Delta 8? And I think she means Delta 10 mean. Now, first of all, you will get a copy of the slide presentation, because as a follow-up to this, you'll get an email. It'll be a link to a YouTube video of the video that you saw, as well as the whole video with the questions and answers, and also a copy of the slide presentation in flipbook format. So you will be able to get that. Now, Delta 8, difference between Delta 8 and Delta 9, if you look over here, is really the configuration of the product as it's put together. And by the way, Delta 10 is much the same thing. My counsel to you is definitely stay away from Delta 10. I'm not a huge fan of Delta 10 at all. And by the way, if you're going to look at Delta 8, really, absolutely check the COA, because the problem I had, I did a webinar one time on Delta 8, and I literally looked at 12 different places that carried it, and only one of them had a Delta 8 product that had a legitimate COA. So be very, very careful of Delta 8 that's out there. Your thoughts, Manny?
I agree. One of the biggest factors is not that Delta 8 itself is bad for you. It's the process in which these corporations are going about to get to it. And it's not even the process in itself, it's the residuals.
Yeah.
Being that there's no regulation on it, you don't know what's left in that product to create that Delta 8 or Delta 10 product. So always liability. We don't want to fall into that vitamin E acetate crisis we had a few years ago.
Right.
We want to be cautious and be safe.
Delta 8 is in a lot of products that are there when you buy the product. It's part of the cannabinoid profile, but a concentrated version of Delta 8, a lot of people, I think, looked at using that to be able to get high. And I guess you'd have to drink a lot of the bottle to get there. But the point is, the way it's processed and the way it's made, be very, very careful. Like you say, you don't want to get back to that problem that we had a few years ago with bad products out on the market. And the propensity to have that happen is very high. Put it that way. Okay, let's jump on to Devin's question. Devin, I have no gallbladder, and I've been told some of my inability to have my effects due to this. Is this correct, or is it all of the edibles not working for me? Without a gallbladder, there's no question that it's going to affect how cannabis is absorbed and being introduced into your body. And the answer is you're probably going to have to go through and experiment and try different products to find out what works and what doesn't work. Your thoughts on that, Manny?
Yes, but also keep in mind you have sublinguals, and then we also have our theragels, which are formulated to kind of have the outer shell break down in the stomach, and then most of it is usually absorbed throughout the gut rather before or after. So there are different products you could still use. We do have trial packs of some things like our theragels. We have 2-pack or 2-count trial packs sometimes. So you can always come in, check these out. But I think sublinguals will probably be the most beneficial if you're looking for an oral or sublingual route rather than inhalation.
Right. Great. Keith asked a really great question. It says, do you think that they're going to lower the controlled substance down from 1 to 3 or vice versa, wherever it goes? What you're referring to is the fact that the Biden administration has just directed the health administration to request the FDA to take a look at cannabis and to reschedule it as a Schedule 3 drug as opposed to a Schedule 1 drug. Now that has tremendous first of all, I'd like to have it not scheduled at all. It shouldn't be scheduled at all, but that's my opinion as a practitioner. But even if it's scheduled as a Schedule 3, it's a huge benefit over being scheduled as a Schedule 1. You'll be able to get a lot more research done. What you're going to be able to do is, more importantly, the cannabis firms and dispensaries will be able to get banking and be able to also, with their taxes, be able to write off a lot of things. So it has a tremendous tremendous impact on moving the industry forward. Do I think it's going to go into effect? I think yes, it will. I think that before the next election, that will be put into place because it's something that's been a high demand from a lot of folks. Over 70% of the nation wants to see cannabis legalized, especially medical cannabis legalized. And so the pressure on the administration to do that is very high. It's not as big of an issue. It's not one of the major campaign issues, but it's enough of an issue that people are paying attention to it because of the population's request to be able to take a look at this. Your thoughts on that, Manny?
I agree. And one thing that I constantly look into and try to consider is it's not just the federal land that we're on that we need the laws to pass on. It's also that we are internationally intertwined into agreements with it being a Schedule 1 narcotic as well. So it's not an easy task to overcome. That's not to say it can't be done or shouldn't be done. And I do believe that will be coming to effect very soon as well.
Yeah, I know that the administration last year worked with the United Nations, and they've come up with a paper that is basically primed for the fact that if the United States drops Schedule 1, they're going to make a recommendation literally around the world, and also with the World Health Organization, to reschedule cannabis in almost every country. So that decision has a rippling effect throughout the whole international community. I think it can only be positive. And again, I just think it's going to be put in place before the election, because I think it's candidly a way of getting more votes. I'm just being blunt. These politicians are looking at everything they can to get elected, and I think this is a damn good one to do that. I would definitely be for that. Stan says, I have to figure out what helps longevity and high tolerance. I use for anxiety and neuropathy. With respect to longevity, I'm trying to figure out if you mean longevity of a person. I'm trying to figure out what you mean by that. I guess I just don't understand that well. How do you read that one?
I read it like he's looking for something that's going to last long enough and is strong enough because of his high tolerance.
Yeah.
And I
patches and things come into play, right?
Not quite, because of the tolerance, the longevity, yes, but because of the tolerance, it may not have the effect the person that
Right.
stands looking for. Um, First, I would try to recommend a tolerance break, as tough as that sounds. If not, implement CBD whenever you're not using it, but you're
Right.
probably using THC all the time because of your tolerance. So then that would also lead me towards the FSO line. But my
Right.
fear is that if I recommend the FSO, which a high tolerance, you're going to plateau, and then you're not going to have any effect.
Right.
Um, so my first stance would be probably I would go with a tolerance break, as intolerable as it may sound, and I think that will be beneficial. And you could use CBD during that time, and then slowly re-implement THC, and you should find that you don't need as much.
Right.
And then do that for a couple of months, and then do another tolerance break. Try to bring yourself back down a little bit.
And this is a good candidate for a consultation too, because I think walking through this is going to be important.
Yes.
Yeah, I think that's really, really important. Anonymous asked the question, I have received a great amount of relief from Calm product, but it doesn't seem to be available right now. Any projection on its availability in the future? Because the terpenes are the best concentration for anxiety, stress, and inflammation. Manny, that's right in your wheelhouse.
That is a great one, and we are working on that with the new products and new launches. One of the bigger problems is getting reapproval from DOH from different labeling and such. It's a whole menage of confusion, and I don't want to bore you to death, but we are not getting rid of it. We are bringing it back. I just don't have a date, and I don't want to give you an expectation that I can't fulfill right now.
Right.
Um, in the meantime, I would suggest microdosing with Soothe. The next one would be 5-to-1 Serene, but 5-to-1 Serene is going to be more uplifting than calm. So if you use, like, let's say half the dropper or 1 milliliter, 1 full milliliter, I would probably go with 3 or 4 drops of the Soothe on a day off, or when you can relax to see how your tolerance is. You might actually you might like it a little bit better, but if not, it should hold you over until we get the calm back in stock, I would hope.
Right. That's a good point. Next question, I think, is yours as well. Can you get consultation over the phone?
You can. It's not going to be necessarily as in depth. So you could call our care line, and they will help you over the phone. They would even help submit an order for you over the phone. They just don't have as much of the base knowledge that we would have in stores, simply because we have we have knowledge of what products we have, and we could get a little bit more personal and intimate with you in person. However, we will assist you over the phone, and then when you come to pick it up or when it's delivered to you, you can ask the consultant at that time for more details if you would like.
Right, that's a good point. Anonymous asked the question, will the dispensaries be working on labels? I have noticed the printing on the labels fades quickly. I've asked the local Surterra near me, and they do not know about that at all. I have noticed that the labels do fade. Your thoughts on that, Manny?
Yeah, so those are heat. They use heat in order to print. So being here in Florida, if you leave your product in your car as hot as it gets, they'll turn black. They'll fade. One of the benefits to that, or one of the main reasons, was for PII or for HIPAA. That way it could be easily disposed. You can't rip the label off as easy, and you want to get your information off. So you could just put a lighter or a hair dryer, and it'll darken, and you could throw it out. However, Surterra has taken a lot of the privacy information off, like date of birth. We only have what DOH, or Department of Health, requires. And to that point, what I would suggest, if you're having issues with that, you can always ask us for a few extra labels to your product so you could be legal and sufficient, and we'll happily provide those to you.
Right, right, cool. Last question is, says, Marc, you should do a seminar on what you do for pain on your back and exactly what you take, and let us know would be helpful to all of us. He has the same physical problems, and is again looking for relief. I have addressed this in a number of webinars, and by the way, I will make sure that we send as a follow-up an email to you on what I took when I left the hospital after my knee operation and what my regime is right now. And by the way, in my dosing webinar, which I do, and also in my pain management webinar, I do address that and actually talk about my regime and my on a daily basis. I don't want to really get into it right now because it really is a morning, noon, night, and then sleep regime. Not complicated at all. It's actually very, I simplified it. But I do want to point out, I can give you what I'm using and why I use it. But I think it's also important that you tailor it for yourself, because again, you have to find out what works for you. but what doesn't work for you, again, it has to do with the terpenes and how your body exactly reacts to that. But that's a good comment, and I'll take that into consideration. Right now, I'm building it into a lot of different webinars, but we'll see what's going on in the future.
If I may piggyback on that, Mark, as far as the hospital is concerned, it brought back a memory. Oh, if you're planning that out and you know you're going to be doing that, always try to set up a caregiver. And it doesn't mean that it's already your husband or your spouse or whomever. They have to be registered with the OMMU or Office of Medical Marijuana Use and have a medical marijuana card. The catch is they have to pay the $77.75 to the state, and they may have to pay a clinic fee depending on which clinic you're seeing.
Yeah, that's a good point. Well, Manny, we've covered a lot of topics. We've gone a long time. I should point out to everybody, we have a full schedule this quarter of webinars. This week, we're doing anxiety and stress. We're going to be covering over the next, in the month of September, anxiety, arthritis, sleep and insomnia. October, we're talking about cancer and fibromyalgia. November, PTS and neuropathy, and December, cannabinoids, as well as how do you get started using medical cannabis, both the dosing, terpenes, routes of administration, and that type of thing. So we have a full schedule. And in the future, please feel free to join us if you have any of these topics. And again, you can register through Marijuana Aware. Manny, any closing thoughts?
It's been amazing. I hope we were able to assist some people. Again, keep in mind, we are available to anybody who wants to come in and see us. And you don't even have to be a patient. If you're looking to see what a dispensary is about, getting a little bit of education, stop in. There's certain areas you can't go to, obviously, but we'll be happy to discuss it with you and assist you in any way we can. Again, my name is Manny. I'm one of the store managers in Pensacola, but we do the same thing across the state, and we'll be here to assist you. I do believe we have that contest at the end of this.
You definitely do. And I should say, Forrest, take it away.
Yeah, hi. So we would love to give away a product tonight for a patient in Florida. So a couple of things that you need to win. One, you definitely have to be a patient in Florida. Two, you have to have our app downloaded because we're going to be delivering you the coupon for the free product through our app. And three, you have to be a member of our loyalty program. So you can download the app in our app store, and on our website, you can sign up for our loyalty program. But what we're looking for is we can give away a free product. There's literally, there's only one set of products in our whole entire catalog that is not eligible for this, and that's our WANA products. But outside of that, we can give away one free product. And I'm looking for 3 of the 4 terpenes that Manny had mentioned that are best for treating anxiety and stress. So if you can drop in 3 of these 4 terpenes into the chat with your first name, last name, plus your email, we will give away a free product for the first person that drops that in the chat.
Okay. Cool. And I'll let you handle that, Manny. And by the way, thank you everyone for watching. I know we've gone a long time, answered a lot of questions, but hopefully this has helped you. Final thoughts, Manny?
Yeah, I'm sorry about that. I just want to say thank you, Mark, for having us. We always appreciate doing this and passing education. And we're looking forward for the future webinars to come up.
Right. Manny, you do a great job. Thank you very much. It's been very helpful.
Thank you.
And Forrest, any final thoughts?
No, it's been great being here. A lot of really good information. I hope that we are definitely able to help some people. I know that myself, I struggle with anxiety, and I learn something every time I participate in one of these.
It's really important. Well, listen, I want to thank each and every one of you that are currently watching. I know that it's gone a long time, but the reason that we do these webinars is to really help people get their life back. If we just help one person get the relief, help them get their life back, then we've accomplished what we wanted to accomplish tonight. And hopefully we'll have more than that, and more than one person. That one person will be you. But I really want to thank you very much, and hopefully this is good information for you. Please join us in the future. And by the way, I do want to point out we have a YouTube channel. Go to marijuanaaware.com. The YouTube channel will not only have the video of anxiety and stress that you saw tonight, it has other videos on different medical conditions and also on some of the basics, like how to get started, terpenes, concentrates. There are videos that are out there. And we did one also on the OMMU regulations, which could be very, very helpful. So please use that as your consultative resource. And we're going to be adding to that library as we go along. And that's, again, marijuanaaware.com. Thank you very much for everybody for joining us. And we look forward to having you join us next week. Thank you.